Hi, we're here today. I'm Dr. Tiffany Meyer,
Hi, good afternoon. I'm Dr. Alifiya Tyabji, one of the pediatricians here at Nova Pediatrics.
and we're coming to you today live, and we're going to discuss cloth facial coverings for children during COVID. So we are maintaining our social distance, so we're going to remove our masks. But it is a timely topic, obviously, to talk about facial coverings with children going back to school, some in person and many virtually still. But we're going to discuss some of the ins and outs of it today. And the first thing is why do kids and adults need facial coverings? And I think many people already know this, but just a brief review is that we know that when we have learned over time that facial coverings really do prevent the transmission of COVID, and many people do not know they have COVID. They may not have any symptoms. We call that asymptomatic, but they can still transmit it. So if they wear their facial covering, then they are not, then they will less likely transmit it to someone. And so I know there's a lot of political issues with face masks, but really face masks are protecting the people you're around, and they're protecting you also. So it's not just a choice that you say I don't want to do it, but it's not necessarily for you. You're doing these. You and your children are wearing face masks to help others too.
Exactly. So again, as you mentioned, the guidelines, as we are learning more about the SARS-CoV-2, which is a virus that causes COVID-19, the guidelines have changed from March.
Yes.
And the reason is because the virus is transmitted through respiratory droplets. It could be transmitted when you're coughing, sneezing, talking. But also, as Dr. Meyer mentioned, adults and children can be asymptomatic. And especially children that, right now, through medical evidence has shown that children, luckily, don't have as, the severity of the illness compared to adults. So they can have very mild symptoms and can exhibit no symptoms at all.
Right. And the studies are coming out that they really do still transmit the virus also, especially those 10 and over. So it's important for everyone to wear their mask. And we'll discuss some possibilities where kids under 2 typically do not wear masks, but most everyone 2 and above can wear masks.
And so this face covering is just one of the major tools in our toolkit to prevent the transmission of the virus. But along with that, what's important that we always emphasize is good frequent hand washing and physical
Absolutely.
distancing and keeping at least 6 feet apart.
That's right. And so I wanted to share with you, I had listened to a talk and I thought it was very interesting. But if someone is a carrier of COVID-19 and they're not wearing a mask, but someone is in their vicinity and is wearing a mask, the transmission is 70%. So that's a pretty big deal. But let's say that the person is a carrier, they're wearing their mask, and someone next to them, near them within 6 feet, less than 6 feet, is not wearing a mask. That transmission rate goes down to that goes down to 5%. And that's huge. So 70% to 5% just by somebody wearing a mask, right? And if 2 people are wearing a mask and one person has COVID, but they don't have symptoms, then that transmission rate's 1.5%. So there really is a significant difference from wearing masks. So if that doesn't convince you to wear a mask, I'm not sure what else would. But
Right. And so, we're here as pediatricians to explain and kind of help you kind of guide your family and to make it an easier process for your children to be wearing face masks or facial coverings.
That's right. And of course, feel free to ask questions, but we are going to try to address a lot of different aspects of this. We kind of said this already, but face masks can be worn safely by children, all children 2 years of age and older, and some rare exceptions, and we'll discuss that. We don't believe that children under 2 should wear masks, and that's a recommendation by the Academy of Pediatrics because of the suffocation risk.
Exactly.
And of course, anyone who's unconscious should not be wearing a mask, right? Because you don't want them to suffocate. And then also anyone who can't by themselves remove their mask for whatever reason, they're too young or they don't have the ability to use their arms, but anyone who can't remove a mask should not have a mask put on them.
Exactly. So those rare instances, if you're unconscious, if you're incapacitated, if you have a physical disability that prevents you from being able to independently remove your mask, that could be an emergency, issue. But also certain children with developmental, behavioral impairments.
Right.
So, for example, if you have severe developmental delays, if you have severe autism, also if you have some sort of structural abnormality with your head or your face.
Right. And that being said, for the most part, if someone really can't wear a mask, the best place for them may be to stay home.
Exactly.
So just to protect themselves and protect others. And then, go ahead.
All I was going to say is, and especially those that are around the children who are not able to wear a facial covering, then the parents and other household members should be wearing facial coverings.
That's right. That's exactly right. And then, the question comes up, when do children need to wear face coverings, right? Of course, at childcare or at school, facial coverings really are an essential part of that when they're going back to school, particularly when they can't maintain that 6 feet. And some places even say 10 feet if you're outside or something of that sort. But if you really cannot maintain social distancing and you're outside, you should still wear your facial covering. If you're inside, clearly you should be wearing facial covering. And particularly it's harder inside to maintain the distance. The other big thing is if the length of time you spend in contact with someone. So if you're in contact with someone 15 minutes or longer in a close contact, that really is another case where face masks should be worn too.
Exactly. And to add on to what Dr. Meyer said, children are now returning back to school, starting preschool and daycares, and a lot of these places do have their protocols and policies set up. So it's important to know what your individual school and daycare policies are. Most of these places, the teachers and the staff should be wearing their facial coverings.
Absolutely. And one last point, even it may be reasonable to consider wearing face masks at home if you're living with someone who's older or is medically fragile or has a serious medical condition. So something else to consider, even at home, depending on the circumstances.
Absolutely.
We get a lot of questions about, what if my child's scared about wearing a mask, right? Because kids might be scared. Masks sometimes can be scary. The best thing to do is modeling it as a parent, as a caregiver, as a grandparent, a parent, or a teacher or a caregiver, is to wear them yourself and show them that it's not scary. But definitely you can have the child practice at home, right? And have them put the mask on, look in the mirror, see how they look. Even maybe play a game with it. This is what we're gonna try this on.
Yeah.
And just so that they get used to it, and even wearing it around home for an hour or two, just to practice and see how it feels and get used to it.
Some things that a lot of the psychologists and occupational therapists have recommended, and what we have seen that's worked so far is, depending on your developmental level of your child, just educating them first, explain to them why we are wearing a face mask, and if they don't want to wear it, ask them why they don't want to wear it. It could be as simple as, oh, it's rubbing against my ear, and we can then address that problem. And then being consistent with it and setting expectations. It's kind of like when you sit down in your car, you have to get strapped in your car seat, or you have to get strapped with your seatbelt, or when you're riding a bicycle, you're going to be wearing your bike helmet. So it's just setting those expectations, and also making it fun, as you said.
Absolutely.
And especially those children who are more visual.
Right. You can have them, if it's an appropriate mask, you can have them draw on it or design it or do something to decorate their mask and make it more fun. You can have them try a mask on their stuffed animal or on a doll or something else. And, so making it kind of normalizing that masks are part of the new normal really does help them, help young children and older children accept it.
Right. So to add on to that, making sure that they are comfortable with the mask that they have, picking it out themselves. that
Right.
allows them to have some sort of control
Right.
as
Choice.
to being having that choice and making it a choice where they can pick out some of their favorite character or pattern
Right.
or color. And then
Exactly.
also sometimes those the elastic straps that go over their ears are not comfortable for some
Right.
children. So you can purchase or make some that have the face mask expanders, or the ones that have the headband with the buttons. Or what I have found that's important is making sure it fits properly. And I would always recommend buying the adjustable elastic ones as well.
So that is very important that it fits properly. There, I've read an article about they are making these devices where you put inside the mask to kind of help people prevent some acne that's happening or to help prevent rubbing, but sometimes they don't fit as closely as they should. So always making sure that the mask still fits snugly around the nose and mouth and chin.
And chin, exactly.
So we're gonna go over a couple myth busters. So these are some myths that really are not true about masks. So one myth is that masks make it harder to breathe, and that is not true. Masks do not make it harder to breathe. There are, if you think about it, there are doctors such as surgeons who wear masks for 10, 12 longer hours a day. All day long they're wearing a mask and they're fine. So as long as the material is cloth, is a cotton material or is a cloth material, they should be just fine wearing a mask. And clearly we don't expect children to wear, 10, 12 hours a day of mask, but for, an 8-hour day of school or so, they should be wearing a mask. If they're in school, that is, of course. And masks do not interfere with the development of the lungs. So that was another concern, that if a child's wearing a mask, are their lungs going to develop normally? And that is not true. Their lungs will still develop normally.
And we get a lot of parental questions about asthma, and does wearing a mask cause asthma symptoms or cause my child to have more difficulty breathing? And the answer is no. It's actually more important if you do have certain chronic medical conditions to prevent your child from getting COVID-19.
Right.
So
Exactly.
if your child has asthma, it's important that your child is wearing a mask, especially when attending school. And if they do have difficulty breathing, it could be because of anxiety, or it could be because their asthma is not well controlled.
Right.
And in that case, you want to follow your asthma action plan, and you can remove the mask to provide your child relief from the difficulty breathing from the asthma, and use your rescue inhaler. And then speak to the nurse or your pediatrician regarding how to better control the asthma.
That's right. So a child with their asthma that is under control should be able to wear a mask just fine.
And even with allergies as well.
Yes, absolutely.
If your child's getting a lot of nasal congestion and having difficulty breathing under that mask, then speak to your pediatrician regarding how we can better treat those allergy symptoms,
Absolutely.
especially the nasal congestion.
To make it more comfortable for them, absolutely. And then one last myth I wanted to address is that masks do not stress our bodies out or weaken our immune system. So contrary to that, they actually protect us more. And allow us hopefully not to get the virus, which is better than we're not weakening the immune system.
Right.
So.
And even before COVID, you would see a lot of people, even children, having to wear a mask. If you're immunocompromised, if you're going chemotherapy, or if you have respiratory issues like cystic fibrosis, these patients are very vulnerable, and it's very important that they've always been wearing masks, and it actually protects you.
Right, absolutely. And that goes on to we kind of touched on this, Dr. Tyabji touched on this earlier, but children are going to ask questions. Why do I need to wear this mask? Why is that person wearing a mask? So talk to them obviously in age appropriate language, but children under the age of 3 may ask questions, and you just explain to them that they're wearing this mask to protect against something called germs. And that some people sometimes are sick who wear masks, and some people who aren't sick wear masks to protect themselves and others. And those children over 3, you can focus a little more on germs, so they kind of understand germs a little more. You can explain how germs kind of affect the body, and you can kind of explain to them that bad germs can make you sick, so that they want to protect themselves and others by wearing the mask.
Exactly. And, adolescents are also going to be wondering, why should I be wearing a mask?
Right.
And again, I think in that age group, it's important to be a role model.
Right.
And to explain that that they shouldn't feel any different, that there's nothing wrong with them. And we're not trying to, stereotype anyone to make them feel that they are sick. But again, it's to protect yourself if someone else around you could be sick.
And again, as Dr. Tyabji is saying, is to make it the new normal, right? So masks are the new normal, and trying to normalize it so older children and teens really can accept it and embrace it and wear the masks also.
Exactly.
Another question comes up, and we kind of briefly mentioned this earlier, but what about children with special health care needs? Should they wear masks, and what kind of masks, and what about them? So, obviously, children with special health care needs, if they're immunocompromised, meaning they have, weakened immune system, they are the ones who really do need to wear a mask, and they may actually even need the stronger mask, the N95s.
Right.
Anybody who's at high risk may need stronger masks. Again, obviously in a safe manner.
Right. And again, a lot of the question was, why can't other people wear the N95 mask? Right. And one of the reasons is because there is, a nationwide shortage of PP, which means personal protective equipment, including the N95 mask. So right now, the N95 mask is primarily for healthcare workers on the front line, and also for those people who are extremely at high risk or have a weakened immune system.
That's right.
And then if you do have a child or an adult in your household who is high risk, you can also protect them by making sure you're also wearing your face mask or facial covering when you are around them.
That's right. And also being careful, obviously, someone who can't take off their own mask should not be placed on their face.
Exactly.
So, and another big part of this is what's the right way to wear a facial mask, right? Of course, and we're gonna show you in a little bit, but there are a lot of wrong ways to wear it, right? But what's the right way to wear it? So the right way to wear it is to obviously to cover the nose and the mouth and the chin, right? So you want it to you don't want it to ride up. I know sometimes they can be too small or too big, and so you want to obviously have the right fitting mask, and you want to be able to have it on. You want it to be worn correctly.
So I think we had mentioned before, it's important to make sure you have that the special fabric, the deep woven fabric, which like cotton, for example, and also have multiple layers, making sure that it's not torn, there's not holes in it, that it's not dirty, and also making sure that it's easily breathable when you are wearing that and fitting you properly over that face. I always kind of make a analogy to wearing underwear.
Right. No, true. Exactly.
You gotta make sure you're wearing your underwear properly, making sure it's covering your important parts, and especially when you're out in public, that you're not, touching and being fidgety with your facial mask.
Exactly, right. And so, no, that makes complete sense, right? And so, and this is an obvious thing, but you wouldn't wear your mask when you're eating or drinking, right? You have to take your mask off when you're eating or drinking. And clearly you want to wash your hands, right, before you put your mask on. And then, I know it's very difficult with children, and you have to find that right balance and expectations. Yes.
But everything we can do will decrease the risk. Of course, you're not going to be able to be perfect.
Right.
But trying to have your child keep that mask on and trying to have them avoid touching that mask and their face.
That's correct. You want to have them, and you want yourself to be touching more the ear loops or the sides, more about the front. And that's also why you're washing hands before you put it on. The other thing that's important is washing the masks, right? To wash them and keep them clean on a regular basis. So many and most of the cloth masks can be hand washed or put in the washing machine even.
So after daily use.
Yes.
One of the questions is, well, do I have to change a mask every time I go into a different store? on on if you're doing an outing and you're going to 3 different stores. No, unless it's dirty, you don't have to change your mask. But after a day of use, do you want to change your mask?
Right. That's right.
And I always recommend, if it's dirty, put it in a brown paper bag, so that way you're not getting other things contaminated.
Right.
And the brown paper bag, allows it to be more, it allows it to dry if it's wet, and also, it's more breathable.
Absolutely. And the next question that comes up is, what kind of cloth face covering is the best, right? So there's so many out there, right? And they say that minimally have 2 layers, 2 layers of material. And I've even read that sometimes you can add a layer of tissue paper, or Kleenex, as a layer.
Or a filter.
Or a filter, even a coffee filter. You can buy filters also. But you want a filter that actually is kind of woven close together.
Exactly.
So, but homemade or purchased cloth facial coverings are perfect. They're it should be a cotton fabric. You don't want to do vinyl, and you can't breathe through vinyl. And flannel may be too hot in the summer, but a cotton, a regular cotton high grade, fibers is a good thing. Sometimes the pleated facial coverings are easier for children, but it doesn't have to be the pleated ones. They expand a little bit more. But you definitely want to find the right fit, especially for small children, right? And a lot of times the sides, the elastics can be adjusted. They can be tied to make them smaller, so it fits better, fits closer to the face.
Exactly. And if you find one that fits and you notice that there is rubbing of the ear loops against your child's back of the ear or the skin, you can apply some Vaseline as a barrier, and that will also help prevent some chafing or some irritation.
Absolutely. And adult size masks typically about 6 by 12 inches, and kids are 5 by 10, but everybody's a little different, right? We have larger adult heads, smaller adult heads, larger kids, smaller kids. So just making sure it fits correctly.
I was going to say, even me personally, even adults, we all have different size faces. I tend to fit better in more of a child adolescent mask. I find adult masks tend to be bigger on me. So it's really important to make sure that fit is the most important. You don't want it to be slipping down when you're talking, and we'll kind of go over some things, but one of the things is not to do is to have your nose exposed.
Right. You want your nose to continually be covered.
And the other thing that I was going to add is a lot of the facial masks or facial coverings come with those little nose wires. And those I feel are really helpful in making sure you're securing a proper fit, especially around your nose.
Absolutely. And many of the personally made masks have a little part where you can put a pipe cleaner in, or a piece of a pipe cleaner, or you can even sew a piece of a pipe cleaner, and so then you can mold it to your nose a lot more easily.
Exactly.
Interesting stuff. As we learn more and more, different recommendations are coming out. But the masks that have the vents can be actually are not protective for the people you're around. So it does protect the person who's wearing it, but you're actually giving off more particles, more respiratory particles with those vents. So really, those are not recommended by the CDC. You want a cloth mask without a vent. You want a mask, even an industrial mask, that doesn't have a vent to it. And the neck gaiters, the things that kind of partial scarves that are pulled up, those at this time are not recommended. They don't think those are protective enough. Those are too thin, and they don't protect the wearer or the person they're around.
Correct. And again, we're still scientists and medical experts. We are still learning more and more about this new SARS-CoV-2, and that's the reason why recommendations are constantly changing.
Absolutely. And as Dr. Tyabji said, the N95s in general really should be reserved for the medical professionals, right, who need them, because unfortunately there's such a short supply of them. The CDC the CDC has some nice visuals on their website about masks and what to choose. But they say the best thing are choose a mask that has 2 layers of washable, breathable fabric, right? So you can throw it in the washing machine after you wear it. You want it to completely cover your nose, mouth, and chin. You want it to fit snugly against the sides of your face, and you don't want any gaps, right? Because unfortunately, the bigger the mask, if it's not fitting well, it's going to gap. And so that lets particles out, and that unfortunately doesn't prevent them from coming in. You don't want a mass of fabric that's hard to breathe through, right?
Especially in this hot weather.
Absolutely. And you don't want a mask that has the exhalation valves or the vents, because that allows the virus particles to escape. And then, of course, we said please reserve the N95s for the healthcare professionals. Do you want to?
Do you want to, so let's talk a little bit about glasses. So a lot of people wear glasses. You again want to make sure that the mask is fitting over your nose, and that sometimes the nose wire actually might be better in those situations, and that your glasses are also secure. And then, preventing that fogging from occurring
is important, right? So the fogging is occurring, if you don't already realize this, but when you're wearing glasses and you have your mask on and it fogs up, it's because your breath is escaping up through the top of the mask. So if you can pinch the mask closer to your nose and get a better seal, then the fogging will subside.
Exactly.
And then a little bit about how can parents teach their children not to play with or tamper with their facial coverings, right? Kids are going to naturally want to play with it, right? And I think the best thing, of course, the easiest thing, the most basic thing is for parents to model wearing, good habits with themselves, and that they keep their mask on and they're not playing with it. I know everyone's human and sometimes it happens, but just try to keep that in mind.
And also start slow and be patient, especially if your child's going to be attending school. Start a few weeks beforehand. So start with short periods of time. Allow your child to touch and hold the mask, and then have them bring it to their face without actually putting it on, or put it on their favorite doll or stuffed animal, and do it in short increments. So first have them put it on while they're distracted, doing their favorite activity or something, and then gradually go over extended periods of time.
Right, and so they get used to wearing it over, a longer period of time, and it is a practicing thing. So I do think that is important. And
then having that incentive, so praising them, congratulating them when they have worn their mask, and maybe having set up a special reward if they worn it for extended periods of time.
Absolutely. And, parents ask about infants sometimes. So, infants, we wouldn't put a mask on an infant, but how do you protect the infant? And the best way really is obviously to avoid large crowds, right? To keep your child home for the most part. But when you do have to bring your child out, to, all of the adults around them, all the kids around them who can wear masks should be wearing masks. So that way you're protecting your infant.
Exactly. So having that physical distancing, and again, frequent hand hygiene.
Absolutely. So the big things, right? Washing hands, social distancing, and wearing your mask. So we have a question here about face shields. So face shields typically have been used in the medical setting, right? So for those who are wearing full personal protective equipment, PPE, in the medical setting, face shields have been shown to be effective.
But not by itself.
Not by itself,
but
correct.
In addition to wearing an appropriate surgical mask or an N95 mask.
Right, that is correct. Currently, the CDC does not recommend face shields for the general public. They don't have enough data to support the effectiveness. But obviously, a mask is the number one thing, and we can't stop you. It's not harmful to wear a face shield, but they haven't proven the effectiveness at this point.
Right. The most important thing is wearing your face mask or face cloth covering, and then you can wear a face shield over, and in some individuals it might actually prevent them from constantly touching that face mask as well. Right. But again, it's also important to have the good cleaning of your face shield as well.
That's important. So if you are going to wear a face shield, make sure you keep it clean, because that can be another source of infection.
But it should never be worn by itself.
Right.
That's the key.
Yes. So face shield by itself, no. Face shield with a mask, okay.
Exactly.
But mask is your base, right? Mask has to be the base thing that you have on.
Exactly.
And what about athletes, right? Students, athletes, professional athletes have started. Some sports have started back. Some of the lower risk sports, or we can get in. That's another discussion. But some of the professional sports are doing lots of things to try to control the spread of the virus. But for a student athlete, for a college, high school, or a younger kid athlete, facial coverings still are very important. And when do they wear them? Of course, they should wear them on the sideline, when they're on the bench or in a dugout. Obviously, they should still try to be social distancing.
Exactly.
And many sports are. Soccer, I know soccer teams that are social distancing, right? They're not sitting all together. They're all spacing out.
Baseball
and
as well.
Baseball's doing that. Many sports are, if they are taking place, they're maintaining social distance with the mask when they're not playing. When they should also, the team should be wearing their masks when they're participating in team chats, right? When the coach is talking to them, or they're asking questions, or they're talking together as a group. And the other thing, going to and coming from the field, the court, the pool,
the facility,
the gym, wherever you're going, still you need to keep the mask on when you're not physically participating in the sport.
Exactly. Except water sports.
Except water sports, correct. So water sports, you could wear your mask to the pool, but when you get into the water, of course, you do not want to wear a mask. Just to emphasize that, you're not going to wear a mask in the water. That's dangerous.
Exactly. Or any sort of activity where that mask could cause injury if it flies into your face, for example.
Or would get caught on something.
Exactly.
So just to kind of summarize and wrap it up here, but the CDC recommends obviously to wear masks. And there's obviously the right way and the wrong way to wear a mask. And I was going to see if we could even show this here, but this is a nice little visual from the CDC, and it talks about when not to wear a mask. And Dr. Tyabji,
You need to hold it closer for you.
And so you're not going to wear your mask right around your neck. You don't want to wear it below your nose. You don't want to wear it. You want to wear your mask. You don't want to wear it on your chin. You don't want to wear it on your forehead or dangling from. Some people dangling from one ear or on your arm, right? You got to wear it covering your nose, mouth, and your chin, right? So there is a wrong and a right way to wear it. I was going to demonstrate kind of how to put a mask on. So let's pretend that I'm putting my mask on. So I did wash my hands before I came in here. So wash your hands first. And then you're going to take it by the sides, the ear loops here.
Or
right?
if you have the ear straps, or the ties.
Or the ties, right? And you're going to put it on. You're going to put it around your nose and mouth. And remember, I'm touching it by the sides, not the front. You're going to do this, and then you're going to make sure it covers your your chin, and your nose. And then I'm lucky because my mask has a nose piece that.
And this is a surgical mask, by the way.
And hopefully you have a mask that has some type of either a pipe cleaner or something in there. Nose wire or a piece of metal that can mold. And you want to make sure that you close it around your nose. You squeeze that part of your nose and it tightens it up.
And making sure around here, the side of your face, your cheek area, there's not an opening.
It should, right? You don't want it open. You want it to fit snug against your face. If it is open here, you can tie these straps a little bit. Put a little knot in each side, and it'll secure it a little bit more too.
Or if you have those with the adjustable straps, you can adjust it for your child.
Exactly. And then taking off your mask, of course, wash your hands again. And then you're going to take it from the side. You're not going to touch the front. You're going to take it off from the sides, right? And then dispose of it. Or wash it, or what are you going to do with it? And then, of course, wash your hands again. Always wash your hands multiple times. I listened to a talk that said it's not how well you wash your hands, it's how frequently you wash your hands. So washing 5 to 10 times a day, the more the better, washing your hands.
And washing your hands properly as well, for the proper amount of time.
Sure. And then, so just kind of summarizing everything, spending, obviously, physical distancing is very important, right? And we do want to try to do that. But there are times when we can't physical distance as much as we want. The 6 feet, 10 feet, whatever we want a physical distance. So that's when, of course, you need to wear your mask, your facial coverings. And that's going to be more and more the case now with kids going back to school and to daycares and playing sports. So it's obviously important to wear the mask and wear it properly. And kids who are sick, parents who are sick, teenagers, older kids should stay home, right? So this is really the time that to be serious about if your child's sick.
And any symptoms. It could just be a cough or a runny nose. If there's questions like this, that's when you'd want to call your pediatrician to know what the next step would be.
Absolutely, and we're here for you. So we have telemedicine visits, we have in-person visits, but we typically, for sick kids, will start out with a telemedicine visit and see where we go from there.
Exactly.
And that all comes back to a couple more things. This weekend is Labor Day weekend, right? And so everybody does like to get together and enjoy time with family and friends, but really you need to be safe this Labor Day weekend. And if you are getting together with groups, try to make it very small groups. Make outside,
outdoors,
social distancing, and wearing masks. So I know some people think being outside, oh, I don't need to wear a mask. But if you're still in close contact with people outside, you still need to wear your mask.
Especially if there's going to be children.
Absolutely.
Then it's important to have them frequently wash their hands, wear your facial coverings, your face mask, and try to not do those large gatherings. And if you're not feeling well or you're showing some signs of any illness, then you want to stay home.
And just remember, you're doing people a favor by staying home. They're not going to be upset with you because you said, I'm trying to protect you because I'm keeping my child home or keeping myself home because we want to stay safe. We want to make sure other people stay safe.
And I think they will be thankful and appreciative if you do that.
If you explain it to them. Absolutely. And then the other very important thing with we're going into flu season, which we don't know what's going to happen with flu and COVID together, which could be a scary possibility. And so flu vaccine is now available. We here at Nova Pediatrics, we have both the flu shot and the flu mist, and we are happy to give it. You can call and schedule an appointment during the weekday. We're also doing weekend clinics. We have a flu clinic running this tomorrow, Saturday, September 5th, and it's going to be an outdoor event, which means you can stay in your car and drive up, and we will give it outside. So I can't think of a better place to be staying safe is in your car, right? That's kind of the ultimate waiting room, basically, and you can.
It's going to be at our Woodbridge office.
So it'll be in our Woodbridge office, which is 1483 Old Bridge Road.
Between 10 a.m. and 1 p.m.
Between 10 a.m. and 1 p.m. Please call, and we can put you on the schedule if you choose to come tomorrow.
Exactly, and then we'll be offering other flu clinics in the future, including at our Springfield location.
Yes, we're currently in the works of planning one for our Springfield location very soon, and of course you can get that during the week. Also, you can call and we can put you on the schedule and get a flu shot any other time.
But this is the best time to start getting your children and yourselves vaccinated.
Absolutely, and the CDC recommends to get your flu vaccine by Halloween, October 31st. So September and October are big 2 months to get the flu vaccine.
Absolutely, and it will protect you for the entire flu season.
Absolutely, so don't worry about that. And you definitely don't want to worry about flu and COVID together. So at least we have the flu vaccine to protect us.
Exactly. So we just want to thank you for joining us today for our Facebook Live on facial coverings for children during COVID-19, and we hope that you will take our recommendations and follow these practices that we've recommended, so that way everyone has a safe and happy Labor Day and future holidays.
Thank you for joining us.
Thank you very much.
Thanks, Nikki.
That was good.
You can click N, right?